When your doctor determines it is time for you to return to sports, a functional test is used to evaluate whether your body is ready for the physical challenges associated with your sport. In our practice, we most commonly use the Y-balance test.
There you go, you saved that one. So we use this test as an appraisal of your movement abilities. It helps us to make an informed decision so we can then decide your ability to return to sport or return to play. Again, let your hips float back.
There are several other tests that may be added in some cases.
So today it's 103.4.
The results indicate whether an athlete is likely to sustain a repeat or new injury.
Do you play club too?
No.
A short physical evaluation and interview will be performed first. That data will be used during the review of the results. The test is performed on this equipment and is comprised of 3 directions of movement performed on each side: anterior or straight in front, posterolateral or behind and across the body, posteromedial or behind and to the side. In each direction, you will be asked to move the sliding box with your toes as far as you are able. You will remove your shoes for the test, and you must position your foot exactly as directed. There are a few unacceptable movements that will disqualify an attempt. These are touching the ground during the motion to recover your balance, forcefully pushing the box at the end of the movement, placing your foot on the rail. You will be given 6 practice attempts for each movement on each side. You may ask any questions during the practice session. When testing begins, the tester will record the best distance you move the block for each of 3 attempts. It is important to push the block as far as you are able and then to come back under control.
Good.
Do your best. Take your time and ask for a rest break if you need it. Straighten your knee so that you can push the block as far as you are able. When you have completed the test, it will take a few minutes for the therapist to enter the data into the software. The results will be reviewed by the physical therapist and discussed with you and your provider.
A lot of good work, so good for you. Excellent.
Your results and other measurements from the physical exam will help to determine if you are ready to return to sports. The analysis includes looking at one leg compared to the other, as well as your overall performance compared to other athletes of the same age, sport, and leg length. The therapist will provide instructions on exercises that will help you address problems noted in the testing session. Together, your therapist, provider, and your family will decide the best time to return for testing again. We encourage you to take our recommendations seriously so that you will reduce your risk of injury and improve your chances of successfully completing the Y-balance test.
Yay!